Well, good morning, everyone. Thank you for being here today. Before I get into my remarks about the conclusion of the 90-day emergency, I want to start off with some other things. I want to start off with some of the issues that are top of mind for many in Portland and across the state. The criminal activity that has occurred in downtown Portland in the last few days is unacceptable and in direct opposition to Oregon values. This includes the burning of 15 Portland Police Bureau vehicles and vandalism at Portland State University's library and businesses in the vicinity of the campus. As your governor, I understand that there is a clear line between exercising free speech and peaceful protest and discriminatory harassment, violence, and property damage. That line was crossed this week and law enforcement authorities appropriately intervened. I want to thank the Portland Police Bureau, Portland State University Campus Public Safety, the Oregon State Police, the Multnomah County Sheriff's Office, and the Multnomah County District Attorney's Office for their proactive and coordinated response to hold those individuals committing unlawful acts accountable to the fullest extent of the law. And it's my understanding we also had support from other local law enforcement, and I want to say thank you for those who are willing to step in if needed. I also want to acknowledge that when law enforcement are called on to respond to these acts, it means their resources to respond to other emergencies like domestic violence, traffic accidents, or even homicides in the community are very thin. The activity and the response is ongoing, and my office will continue to be in communication with all responding authorities and provide updates as necessary. Given all that, I'm proud to stand before you today with my colleagues from the city and the county with two focused, concrete examples of our three governments working in lockstep with one another to serve the public. The events of this week that I just spoke about, and the 90-day tri-government emergency that ended this past Monday on April 29th. Just over 3 months ago, the mayor, the chair, and I shared with everyone that the uniqueness of the fentanyl crisis required us to respond with the highest possible level of coordination. The 90-day tri-government fentanyl emergency achieved that and more. One of the accomplishments from the last 90 days that you can learn about in detail in the report that was released this morning is the start of a private sector partnership in the next steps to address the fentanyl crisis. This kind of partnership is in keeping with the intent and spirit of the Portland Central City Task Force from last year, which originated the recommendation of the emergency. I want to recognize and introduce several individuals behind me, behind us this morning, who can speak to that private sector commitment and intent going forward. Steve Witterly, who is the Operation Director of Downtown Portland Clean and Safe. Tessa Pederson, who is the General Manager at River Place Hotel, who is the incoming Chair of Downtown Clean and Safe, and Terrence Pascal, the Director of Asset Management at the Standard, who is on the Board of Directors for Downtown Clean and Safe. There's a lot of interest for us to continue the partnership with the private sector to address the concerns of the fentanyl crisis, to maintain the momentum of the work that we've done in the 90-day emergency, and to engage more directly with the private sector on collaboration. There's just going to be a need for a dedicated team funded by private sector leaders to coordinate with the city, county, and state to strengthen and expand the substance use disorder continuum in partnership with the homelessness response system. Preliminary discussions with United Way of Columbia Lead. The United Way of Columbia Willamette are underway to be that conduit for that private sector involvement. The bottom line is we all have a role in addressing the crisis, and I'm grateful that business leaders in the nonprofit sector are stepping up in a big way. In addition, among all the collaboration state government has and will continue to bring to this effort, I have directed the Oregon State Police to extend their presence in Portland for another 6 months to continue their joint missions with the Portland Police Bureau and assist the peer outreach program that you will hear more about from Mayor Wheeler. There's more work to be done. We all know that. And I want you to know that the state will continue to be a key partner in the work here in Portland. And you can read about that in the report. We have a lot to talk about today, so I just want to wrap up by thanking people. We had 52 people who stepped away from their regular job in the 90-day emergency to focus on this effort with diligence and with care for the people who are impacted by fentanyl, and with an eye towards long-term strategies that we have to continue to focus on. And I also want to thank collectively the hundreds of people from the state, the county, the city, and community partners who every day are facing the issue on our streets and responding to the fentanyl crisis that we are seeing. We see you, we appreciate you, and we have to keep going. And with that, I'd like to welcome our Chair of Multnomah County, Chair Jessica Vega Pederson.
Good morning, everyone. Thank you so much, Governor, for your partnership in this. I'm Multnomah County Chair Jessica Vega Pederson. I appreciate all of you being here today. I want to start out this morning by reiterating the statement that Multnomah County Sheriff Nicole Morrissey O'Donnell, Multnomah County District Attorney Mike Schmidt, and I made yesterday in response to the damage to Portland State University in our downtown. As Chair, Sheriff, and District Attorney of Multnomah County, we unequivocally condemn the criminal actions that damaged our public university, burned 15 Portland Police Bureau cars, and harmed local businesses. We are united in our commitment to protect the right to freedom of speech and expression while ensuring the safety of our community. Those who engage in unlawful activity will be held accountable to the greatest extent of the law. Multnomah County will continue working in close coordination with the Portland Police Bureau and Oregon State Police to make sure we are prepared to respond to acts of violence and criminality. And now to the matter at hand. A little more than 90 days ago, the mayor, the governor, and I charged a unified command with a clear directive to leverage our combined resources to meaningfully change the fentanyl crisis in our streets and in our community in Central City. We know many of the harms and death we've seen are due to changes in the potency of substances, and that these deaths are compounded by social factors, including increased isolation, economic challenges, housing shortages, and instability and systemic racism. We wanted to lead together to increase coordination in responding to this very human toll, because we know that we can do better. We know this community deserves a human-centered, coordinated response. And we're pleased to stand before you today to say that important progress has been made. We know that fentanyl touches every neighborhood, every zip code, every corner of Multnomah County. For me, one of the most important priorities in taking part in the Central City emergency, which came out of the work of the Governor's Central City Task Force recommendations, was that these best practices would inform every county-wide initiative from here. That has happened and will continue, including the work to collaborate on a sustainable, scalable, and county-wide model. We've said we would increase the visibility and coordination of our outreach, leveraging services from the county's downtown behavioral health resource center to continuing offering access to day services and improved connections. This has been a focus, with more than 1,600 outreach contacts in just 3 months. These connections have been vital to our success, and something I invested nearly $5 million towards in my proposed budget through harm reduction and safety on the street investments. This has happened especially through the work to expand our successful pilot between the Mental Health and Addictions Association of Oregon and other behavioral health resource network providers and the Portland Police Bike Team, increasing our footprint in our streets and changing people's lives, especially many who had never been connected to services before. We said we would move people more quickly into treatment, shelter, or housing. That has happened, with nearly 80 referrals to treatment or detox, 300 referrals to shelter, and more than 30 referrals into housing programs. We said infrastructure would be addressed, and it has. We've installed or upgraded 50 lights, including placing lights around the Central Library, and washing more than 250 blocks of sidewalks. We said we would increase distribution and train partners on Narcan so that more people would be ready to help. We've moved more than 4,200 doses of naloxone across our system in the past 3 months, and we've reversed almost 200 overdoses. People who use drugs can get naloxone and fentanyl test strips through our harm reduction clinic. Naloxone is also available for teenage students at high school student health centers and community health clinic pharmacies. It can be purchased through major pharmacies and is covered in part by most health insurers, including the Oregon Health Plan. Our law enforcement division in the Sheriff's Office has been participating in the 90-day emergency work group to combat the spread of fentanyl. MCSO has a dedicated team that disrupts and dismantles large drug trafficking and criminal organizations. In the first 4 months of 2024, the Dangerous Drugs team has seized almost 28 pounds of fentanyl powder and more than 26,000 fentanyl pills. We said we would increase coordination across county departments and programs to be sure our responses use all the resources that we have. We have done that by adopting a one-county approach that reduces silos in our departments and increases our ability to respond to the people who need us with a trauma-informed, human-centered approach. And we've moved important initiative forward during this emergency, including organizing multi-agency public safety missions to arrest drug dealers and connect people with treatment, creating unique unique data dashboards to more completely map fentanyl-related deaths and overdoses. We've expanded peer outreach programs that offer same-day services, and we've dramatically expanded access to life-saving opioid reversal medication. We said that declaring this emergency would help us address gaps in our system, especially for qualified mental health professionals and behavioral health workers. We know many stem from a lack of workforce across every sector: law enforcement, treatment providers, outreach workers, first responders, and shelter staff. We're increasing workforce incentives with a 3.3% COLA increase for all health and human service contractors for the county in my executive budget, helping to continue to increase the baseline wages we needed to do this meaningful work. And we've undertaken a groundbreaking effort to stabilize providers and workforce. $10 million in grant dollars that went through United Way to 61 providers for salary, stay bonuses, professional development, professional sustainability, and longer range steps to look carefully at our entire contracting process. We know that expanding shelter spaces require staff, and that these are tough jobs that require strength and stamina. I want to thank everyone out there who is stepping up to do this work. Many of you who have been deeply involved with the work of this emergency and the work that we do every day. We see you and applaud your efforts. This emergency gave us opportunities to elevate discussions with providers, especially during the half-day summit put on by the health department in March. 150 providers and peers connected to consider pathways to recovery and move into interactive conversations around prevention, harm reduction, treatment, and recovery. These gatherings will continue quarterly from here on out, one of the many connections that will continue forward as we work towards increased staffing for key public services, especially during weekends and evening hours. As our local public health and mental health authority, Multnomah County has worked closely with people who use drugs for decades. As we align with the Oregon Health Authority's overdose response plan, we'll continue to bring the right public health focus and leadership to our coordinated response. Prior to this emergency, our health department developed an overdose response plan with new goals, objectives, and targets to slow the rate of death from overdose. Now our attention turns to the future work that must be done, both in continuing to implement this plan and as outlined in the 90-day fentanyl emergency report being released today. Multnomah County's specific actions included in that report and in our next steps forward as a county include a continued weekly 8 a.m. call between Portland Solutions and Multnomah County Emergency Management to collaborate on a sustainable, scalable, countywide model for regular coordination between law enforcement, outreach workers, business districts, behavioral health, homeless services, and others, including a call for our East County region. There will be monthly cross-disciplinary planning calls across all 3 jurisdictions, nonprofit and private partners, to sustain progress and accountability on incident recommendations. And we're expanded naloxone coordination and distribution, including expanded leave behind policies, and continue to saturate high-risk areas and groups. We know that stopping using fentanyl, even for a few hours, is so painful and hard, which is why we're going to literally meet people where they're at with an increased number of mobile clinics offering medication-assisted treatment. One of my major issues with Measure 110 was that it was put into action without many of the health components that were needed. When I visited Portugal to take a closer look at their systems, I saw a mobile clinic in action and saw what was possible in terms of connection made when you go where people are. It is going to take quality data to get results in this crisis. Our way forward includes greater data integrity that dates, vets, and stores information in ways that can be better referenced. We're beginning the work to build a multi-agency data team to more effectively track metrics. This includes continued improvement of fentanyl overdose data sharing and the expansion of Oregon Health and Science University's mission control capacity to provide a real-time addiction treatment tracking system. This work partners with the work of the Joint Office of Homeless Services on a tool to share real-time data on shelter bed capacity. These highlights reflect just a few of the many, many actions moving forward. Some of the larger, more systemic investments include aligning with our Homeless Response Action Plan and our Health Department's 2024 Overdose Prevention and Response Plan, including a countywide operational oversight committee led by my office. We have already started a program to provide connections into services people will need when changes to our drug laws through House Bill 4002 go into effect on September 1st. And we're pushing forward with this work. We've got an aggressive timeline, but we have prioritized this work to ensure that law enforcement has the tools they need to directly connect someone to services. Without clear action, many more people will be caught in our justice system. I've convened a leadership team and hired a coordinator to focus on having our deflection system ready to go on September 1st, and we will make this deadline. We know young people are uniquely vulnerable to misinformation about fentanyl. Reducing youth exposure and preventing untimely and tragic overdose deaths must be a primary driver in our work. Today, I'm pleased to announce the launch of a fentanyl awareness campaign focused on preventing young people ages 13 through 20 from initiating use and dying of overdoses. Messages will appear on billboards, bus benches, and social media with the theme, Expect Fentanyl, highlighting the dangers. This campaign is the health awareness and further education young people and their families need. I want to close with a thank you to the dedicated team of 52 people who gave so much to this 90-day effort. This is an unprecedented example of coordination, collaboration, dedication, and just plain hard work. I want to especially thank the many people from Multnomah County who participated in this effort. Dr. Jennifer Vines, Chris Voss, Nisha Saxena, Anthony Jordan, Abby Stamp, Stacy Cohen, Dr. Bruno, Rachel Banks, Heather Mirasol, Deanna Negrete, Denise Pena, Rachel Pearl, Ryan Yamba, and so many others. You've given the gift of your time to your community and have shown what can be accomplished locally and what can be a starting point for other communities to follow. Thank you. I'm now happy to turn the podium over to Mayor Wheeler with thanks for the city's partnership during these last 90 days and beyond.
Thank you. Good morning, and thank you both. I will first start off by saying how much I appreciate my colleagues' collaboration and support for the issues that we've been experiencing here in the city of Portland and on the Portland State campus for the last several days. In particular, Governor, I'd like to thank you for the Oregon State Police. That's been a critical partnership throughout. I'd also like to thank the county sheriff and the work that Multnomah County has put into collaboration here. Certainly our law enforcement partners, we have been asked repeatedly over the last several years about mutual aid, and I can tell you under Chief Day, mutual aid has dramatically improved. And I want to thank all of the law enforcement partners who offered their support, who actually participated in this event, and who have committed to working with us going forward. And last but certainly not least, I want to thank the business community. They've done a terrific job of reaching out to businesses in advance of some of these anticipated actions, preparing businesses, large and small, for what could be. And they've worked with us on the outreach subsequently, particularly those 6 businesses that were directly impacted by vandalism. And I'm very pleased to say that those businesses are recovering, and we support them, and we thank them for their continued leadership. So today, alongside Governor Kotek and Chair Vega Pederson, I'm very happy to share the progress that we've made in the context of our 90-day fentanyl emergency declarations. Reflecting on the past 3 months, it's evident that our collaborative efforts have significantly advanced our capability to manage and to mitigate some of the challenges posed by fentanyl in our community. Over the past several years, my administration has been deeply committed to enhancing our public safety initiatives in response to the deepening fentanyl crisis on our streets. It's gratifying to report overall that this work has resulted in Portland trending in what I believe is the right direction, with crime decreasing in some very important categories across the city. Shooting incidents are down 42% since 2022. Vehicle thefts are down 36% year over year. And we've hired a total of 261 new staff within the Portland Police Bureau, well on our way of accomplishing my goal of hiring 300 new PPB staff by the end of 2024. It's my hope now at this point that we will actually exceed that goal. These improvements in public safety are mirrored by a recent study that showed that visits to downtown Portland are up 14% year over year. Despite this positive news, we continue to confront the rising challenges created by the use of fentanyl and its related addictions, and ultimately for some fatalities. The impact of fentanyl is obviously devastating. It's a crisis that disproportionately affects Portland's central city, and it's obvious to everybody that it's straining our public safety resources. The statistics are stark. Deaths attributed to synthetic opioids, including fentanyl, surged by 77% between 2021 and 2022. 70% in 1 year, just in Multnomah County. In fact, between 2019 and 2023, Oregon's fatal fentanyl overdose rate has grown to be the highest in the nation, with an over 1,500% increase. And here's another important fact. Alarmingly, our homeless population is 37 times more likely than the general public to succumb to an overdose, 37 times. This crisis unfolds daily on the doorsteps of our homes and businesses, and I can safely say that it affects every single person in this community in one way or another. In response to this crisis, my administration, over the last 2 years, has enacted 5 emergency declarations aimed at addressing Portland's most pressing issues. The emergency declarations I signed created much of the city's infrastructure that's now taking center stage in the response to the fentanyl crisis. These actions build on our experience with emergency operations related to homelessness, livability, and public safety. Notably, the establishment of the City of Portland Street Services Coordination Center, SSCC, has broken down bureaucratic silos. It aligned city bureaus to deliver a coordinated and compassionate response to the needs of our community. The city's Temporary Alternative Shelter Site program, or TASS, has acted as a much needed place for those experiencing homelessness to receive access to services, and many of those services being provided by Multnomah County, and then transition into housing for those who are ready for that housing. The Public Environment Management Office, or PEMO, has continued to work directly with the entire Portland community to target livability and safety issues, including litter, graffiti, and activating public spaces. These programs, the SSCC, TASS, and PEMO, are all programs spearheaded by my administration that continue to play significant roles in collaborative and agile problem solving. As I announced in my proposed budget yesterday, these successful programs will be institutionalized. They will be fully funded, and they will go citywide under the city's new Portland Solutions Program hub. Portland Solutions will continue to lead the city's coordination efforts established under the 90-day fentanyl emergency declaration, ensuring that our response to this crisis is as effective and as sustained as possible. I'm pleased that the pilot partnership between the Portland Police Bureau's Central Bike Squad and the Mental Health and Addiction Association of Oregon, or the MHAAO, which has shown promising success in connecting vulnerable individuals with essential services. I want to be clear, again, my budget fully funds public safety, police, fire, 911 emergency response. It also includes important components of the work we're now collectively doing, chat, bike patrol, and other critical services. Under this 90-day emergency, the city, the county, and the state jointly funded an expansion of the important pilot around the bike patrol, which provided a physical space, better coordination, and continued efforts to expand these outreach services. The partnership here is critically important, not the least of which is that it represents what we can achieve when we think outside the box and lean into partnerships to find solutions. While I was pleased with the results of the work we were doing individually as a city, the fact of the matter is that this 90-day fentanyl crisis declared 3 ways between the state, the county, and the city has allowed us to speed up the implementation of these processes citywide. It has enabled us to expand the partnerships like the bike patrol that includes PPB and the state police, and it portends a faster strategy for people to move off the streets and into housing through support like TAS and the county's good efforts there and the state legislature and the governor's support of our TAS sites. So this 90-day fentanyl emergency, from my perspective, enables the partnership, the funding, the coordination, the communication to all come together in a way that allows us to have success that we could not have achieved on our own in the absence of this 90-day emergency declaration. I also want to say that I think this type of work is critically important to helping the people who are most impacted by the issue of fentanyl, helping them connect to services to help them get off and stay off the streets or the circumstances that they find themselves in. I'd like to thank Governor Kotek for her forward view on this as well, for a commitment to an additional 6 months of the Oregon State Police presence. We greatly appreciate this partnership and the increased capacity that it provides. During this emergency, Chief Day and the team at PPB have agreed to expand the Central Bike Squad so that they can maintain a positive presence in the Central City during evenings and weekends. So that is an expansion of the program. Chief Day has also found a way to expand the narcotics and organized crime unit to enhance its ability to investigate overdose deaths for potential Len bias prosecutions and provide additional personnel to investigate distribution cases with our many public safety partners. I also want to take a moment to acknowledge the great work of the City of Portland's Community Safety Division, which houses a number of our critical public safety programs, all of which I'm advocating to be fully funded throughout my recent budget. As we move forward, it's clear that continued and increased collaboration among the city, the county, and the state is essential. We will need ongoing support at all governmental levels to scale our response appropriately and to address this crisis effectively. I extend my deepest gratitude to Governor Kotek and to Chair Vega Pederson for their unwavering support and partnership. Together, we've made significant strides towards a safer and healthier Portland. I also want to thank Mike Myers. Where'd he go? There he is, in the hat there. Thanks, Mike, the city's incident commander, Stephanie Howard. Where's Stephanie? Where? In the back, hiding over there. Thank you, Stephanie. And my administration's Director of Community Safety, Skylar Brocker-Knapp, standing over here, who is my Senior Policy Advisor for their really exceptional leadership over the past 90 days. We stand here, we get the credit, sometimes we get the blame, but the truth is behind us are many, many, many dozens of people who work so tirelessly to do this work day in, day out, early mornings, late nights, and everything in between. And all three of us owe them a debt of gratitude for their hard work. This dedication has been utterly instrumental in our achievements. I also want to thank the dozens of people who worked tirelessly on this effort as part of the incident management team. This was a huge task. I'm grateful for your efforts, your expertise, and your commitment to saving lives here in the city of Portland. Today clearly does not mark the end of the fentanyl emergency on our streets. Based on what we've learned, we must redouble our efforts throughout the city and maintain the sense of urgency necessary to meet the fentanyl crisis head-on. There's still a lot of work to do. We all acknowledge that. I'm committed to continuing the partnerships we've built that are critical to safeguarding the well-being of all Portlanders. Thank you, and I'll turn this back to the governor, who I think is going to introduce some guests.
Thank you, Mr. Mayor. I think we can take some questions, and we have individuals here for follow-ups. We have providers here, we have first responders, folks that I've introduced in the business community. So if you have questions, we can do that afterwards with them individually. Here's what I want to say before we take questions. One of the things in the Central City Task Force that we heard from, whether it was fair or not, was the perception that the city, the state, and the county weren't working well together. That's clearly, through this emergency, you can see, and through this conversation this morning, that is not true. And we are all working collectively, collaboratively, together to take on issues such as the fentanyl crisis in the downtown Central City. What's different, if you look in the document, and there's a lot of information there that I think we've had a lot of national interest on what we're doing here. There's a lot of appendices of like how we've brought an emergency management structure to this. Lots of good reading for folks to see what we have done. But in the executive summary, we talk about primarily the system accomplishments. We didn't have baseline data. We now have baseline data. So we can know if we're getting better. We're gonna continue to have the regular ongoing meetings. I attended an 8 a.m. Call. They were doing them daily. To see everybody on a Zoom talking about what they're doing every day with hard numbers, we're gonna continue that on a weekly basis and then make it countywide. So that kind of check-in every day is going to continue. I've talked about the private sector commitment to continue forward here, and the partnerships, things that we've come together to fund, like the partnership between the Mental Health Association of Oregon and Portland Police to work directly on the street. Look, there are a lot of good things happening. There's more work to do, but we wouldn't be here if we had not done this 3 months ago to say we got to all work together differently, and we are doing that, and there's a lot of good work happening. I want people to know that, and we're going to continue doing that because it is a good foundation, and we're going to keep going forward. So, questions?
Bryce?
Yeah, I'm Bryce with OPB. I'm kind of just wondering, why did this work require, a 90-day state of emergency to accomplish? Fentanyl has been an issue for a long time at this point. Why wasn't this kind of coordinated work happening before?
Well, here's what I would say, and I'll let my colleagues speak as well. Remember, we had just come out of a global pandemic. At the same time, fentanyl became a crisis that I don't think any of us could anticipate, a very dangerous drug. So we finally had a chance to catch our breath and say, we have to do this differently. The value of an emergency declaration is you can move things quicker, you can procure, you can get people to do work. We brought people from their regular jobs into this in a coordinated fashion. When it's an emergency, you gotta act like an emergency, and that's what we did. And because of that, we have a deeper, better foundation for the work going forward. I don't know if you wanna.
Yeah, thank you. No, I think that, obviously, as I said in my statements, Multnomah County has worked with people who use drugs for decades as part of our public health and mental health response. I think what this did was really act as a crucible for our three governments over these past 90 days to really focus in on the type of work that we needed to do and build upon as we look beyond the 90 days. As the mayor said, we know that the fentanyl emergency is not over. No one expected it to be solved in 90 days. But what we do have now is more information, more data, more coordination, and more alignment in terms of how we're going to work together to achieve the goals of bringing more resources into the system and expanding those then countywide. And I also think that this is a model that can be used in other parts of the state as well.
Emily?
Governor, can you explain why you decided not to extend the bottle bill exemption at the two downtown stores, especially since a lot of people asked for an extension, including the Northwest Grocery Store Association, which owns the Safeway, and a number of business owners in the area said that it had actually improved the area, so I'm just wondering, why did you decline to extend that?
I think the conversation about the bottle return, the returns, and changing the policy on a temporary basis was the right thing to do, which we were allowed to do under the emergency declaration. I want to remind people there's a law, so under the declaration, we had the ability to make some changes. And it was based on a specific hotspot need. It has gotten better. I think we all have to be flexible going forward to look at our bottle return policy statewide and make some adjustments. that would have to be done by the legislature. One of the things that I will support is what we heard in this discussion about the 24/7 retailers like the 7-Elevens and Plaid Pantries having to take returns at late night. That is unsafe for workers. That requires a change in law to do that, and I'm supportive of that. So not only have we done something specific, but we've learned how to improve things going forward. Right now, my message to retailers is everybody has to do their part, because when some retailers aren't doing their part, it then puts it on other retailers. So you all do your part. And we're looking at the data. The data has shown that, we'll continue to look at it, that there hasn't been movement to other parts of the city. And we believe the particular issue at those two retailers that suspended has been solved. But we're gonna continue to watch it and make sure. So right now, we're back to what we're doing, and we're gonna continue to watch, and we have to be flexible going forward.
That's all, what do you mean by that?
Well, I think what we have seen is, if you wanna speak to this, Mr. Mayor, but at the Safeway and the adjacent Plaid Pantry, whatever was happening there has improved. You know, there's, you know, the hotspot of folks who were using there, the police response, that has cleaned up, right? That has definitely changed, and I know people are appreciative of that. We're gonna continue to look at the bottle return data to see if there's anything else we need to be doing there. I am a supporter of maybe trying to bring another Trash for Peace group in. They're on the central city, they're on the east side. We need a place where folks can go in a safe fashion to get connected to services to return their bottles, and that also will take some pressure off the retailers.
Courtney? Mayor?
Did that answer your
Mayor
question?
Campbell.
If that answers your question, I don't need to chime in.
Any additional?
Yeah, so first of all, I'll just second that 10th and Columbia has improved dramatically. The governor's right, we need more data because we need to disaggregate different types of programming in that area to see what the impact of the bottle drop was. There are other issues that we should explore. And it's not just related to police data. I'm also interested in the economics of the fentanyl trade. And we should evaluate whether or not the bottle drops are becoming an ATM for the fentanyl trade. We don't have enough data at this point to be able to say for certain, but we do need to look at the entire bottle drop program. It's been around for a long time. It has not been remodeled to accommodate current circumstances, and I would strongly support the legislature taking up this issue, and we would absolutely chime in on it. Thank you.
Courtney?
Regarding the mobile treatment clinics, we know that withdrawal and successful treatment often takes, 30 days, 60 days, even longer. How does that align with that? How will this align with that?
Yeah, thank you, Courtney. This is a critical part, right, of being able to meet people where it's at, to make it easier for people to get some medically assisted treatment to help them as they are going through their path out of addiction and into recovery. It is also just one component of the larger behavioral health system investments that we need to make sure that we are continuing to make available the resources, the treatment, the stabilization, the recovery housing, all parts of the system that need to grow on. So what we've seen, though, is that it is about reaching people where they are when they are. We know that oftentimes it takes 1, 2, 5, 6, 8 times for somebody to get an outreach, get a connection, to be able to really take that step into stability and recovery. We saw that happen during this 90-day fentanyl crisis, and so we want to be able to expand those opportunities.
So in that process, is there somebody who follows up with them, or is it here's the medication, follow up with us if we need to? I don't know if you can expand on that.
Yeah, I mean, so some of the models that we've seen and we have used is regular visits that go back to the same place, so that people know that they can rely on that is where they're able to access the services, the outreach, and the medication that they were going to need. So it's really a consistent place. So instead of having somebody have to go maybe like take a bus across town to get to a certain place, this is coming out to folks in the community and being kind of a relied upon resource there.
Ezra?
Salzburg, Chairman Vega Pederson. One of the things that we've heard, especially from the Health Justice Recovery Alliance, is there's just not enough detox facilities. And even with the medication-assisted treatment, with the strength of fentanyl, many people will have to go through detox before they can access MAT. What's being done to increase access to detox so that MAT can even more?
Yeah, I really appreciate this question. That goes back to the answer before, is we have to and are making investments across the system in order to make sure that we've got the right the right steps and the right resources for people wherever they are, whether that is a sobering center for somebody who needs immediate treatment, whether it's access to detox, whether it is a stabilization bed for somebody to go once they're done with withdrawal and detox when they're, so they can get ready for treatment. So we are making investments across the system. I appreciate the investments that we've had in the recent years from the legislature to add additional dollars into our behavioral health system in order to do that work. We have been, we're working closely with partners across the board, from Central City Concern to other, FOR and other partners, to really look, to say, what can we do? So we're gonna be looking at increases in detox and withdrawal. One of the things that we are doing right now and getting ready for the House Bill 4002 full implementation on September 1st is having kind of an assessment and intake center set up so that people have that place to go. That's in parallel with the longer work that we're doing in setting up a sobering center, and the long-term plans for that also include coordinated services like withdrawal and detox.
And can you expand on kind of what will be set up for when that September 1st deadline hits? Because what we know right now is that people are showing up to detox and not being able to get it. Folks who want it can't actually get those beds. So will you be ready on September 1st?
So what we're talking about September 1st is truly having a deflection process in place so that somebody who is now under the new recriminalized charge of a possession of a controlled substance has an alternative path than being arrested, taken to jail, really having that connection with our justice system. Instead, we want to be able to deflect them into a place where they can have access to services, where there's more health, behavioral health focused and more peer support, right? So really trying to do the work of setting up that alternative system that we didn't have under Measure 110. So in September 1st, our work really is about having a deflection process. One part of that deflection process is going to be having a drop-off center where people can go, they can have intake and treatment, have a peer that can connect with them, and then get connection into services or get directed into services. It is not going to be a detox or withdrawal center, on September 1st, but that is part of the longer-term work of how we can build up the system. And I think you wanted to
Just
talk about
briefly,
state
so all the counties who are early adopters of the deflection center money, not only Multnomah County, remember, this isn't everyone. This is a new crime that will affect certain individuals, but we have to be ready. So the state is working with partners to make sure we are ready and following best practices on day one when the new crime goes into effect. Two things I want to say, and one of the benefits of the fentanyl emergency is, and I said this to a couple folks during the last 3 months, if there's an open bed anywhere, we want to know where it is and we want to get people in it. I never want to hear there's an open bed not being used. So I think we're doing a better job there because of the coordination that's happening on a regular basis. We're also continuing to push the funding that's gone to OHSU to have a real-time tracker of what is available, because as we continue to build more resources like we all did at the end of last year, putting money into the recovery, the new treatment facility that Central City's gonna run at Lolo Pass over on East Burnside. We all stepped up and threw some money into that so it could be ready by the fall. We need more capacity, but every piece of capacity we do have has to be used better, and that is also something we're focused on.
Heather.
Governor, on the expanding the state police presence downtown, we know OSP has been in a staffing struggle for the last several years. Those troopers that are working downtown must be coming from somewhere. What region is now lacking that patrol capacity with those troopers working downtown that wouldn't normally be doing that work?
Yeah, I think I would rephrase it in that. I don't think we're taking capacity. We're flexing current capacity on a intentional way to help out PBB. So we're going to continue to extend what we've been doing, and we've been very cautious not to overcommit because we do have to, serve the entire state under the Oregon State Police. I will probably have to go back to the legislature here later in the year through the emergency board for some resources because there is additional overtime and things like that. But we are trying to maintain it, but be realistic, and another 6 months of OSP working with PPB is really important, and we're committed to that, and so is Superintendent Cotty.
So you're saying that that's not, those troopers weren't doing something else elsewhere?
Well, we're flexing from their regular patrols to do this work. I'm not going to go into a lot of detail there. And we do have more folks coming out of the police academy, same for Portland, same for OSP, so we're ramping up. But again, trying to maintain current service level, but asking people to do a little more. And I'll be honest, It's been a strain on our folks, but we're committed to it because it's been having a great impact, so we're gonna do it for another 6 months.
Tanner?
Question, for doing it for Vega Peterson. I remember at the beginning of the 90-day consultation, some information expressed concern about the impact that other parts of the county. Can we expect to see this kind of tri-government collaboration in other parts of the county, such as the
Yeah, absolutely. So all three of us are committed to continuing this work in partnership together because we've seen such a big impact in what's happened in the Central City region over the past 90 days. So we are going to be continuing with the 8 a.m. calls where we're bringing all three governments providers, people from, from the different areas of this work to be meeting to talking about those. There's going to be, starting in July, there's going to be those calls for the four different quadrics in the city of Portland and one for East County. We're also, really interested in looking at the baseline data that we've been able to create through this process and really understanding more clearly where the other hotspots are happening and how we can focus on that. So I look forward to continuing the work with the governor and especially the mayor and the city in examining those other areas. We know, for instance, that the East County areas of Rockwood, of East Portland, we know that there are huge need in there, and that's another area where I think we can build on some of the work that Mike Myers and his team has been doing in Hazelwood, for instance, and continue that work.
Joelle?
My question is for Mayor Miller and about the event at PSU. I wanted to ask, after clearing the library yesterday morning and closing down the South Park block with hundreds of protesters still there, why did police choose to retreat and allow those protesters to reoccupy the library?
I'm going to defer that to the police bureau. That was a tactical decision.
I haven't gotten everybody even once. Okay, John?
So we've discussed how hard it is for people when they start using fentanyl, especially for the governor, not that way. When people start using fentanyl for the first time, how difficult the recovery process is. Outside of the awareness campaign for 13 and 19-year-olds, for older people, what is being done to make sure people don't become first-time fentanyl users? As we said, the recovery process is difficult.
Well, I do think we all have to recognize the dangers of fentanyl and get that message out. I think young people are a good place to start, but I do think this type of work is raising awareness. When we hear folks who are ready to get into recovery, as you're commenting, and they can't go an hour without some support because of the addictive nature of fentanyl and whatever else is in that fentanyl, because now I'm hearing about different types of fentanyl, it's a significant change in our response system. That's why I think the approach that the state wants to support as well around different types of medically assisted treatment on demand in a quicker fashion is going to be important. As you know, I'm visiting all the tribes this year, and we were out at the Confederated Tribes of the Silettes, and they have a program there where they, because of what they have locally in their clinic with the medical professionals and the outreach workers working together, they're able to do a long-acting injection to help people get stabilized. We have to understand that fentanyl requires us to do things different. We have been working under the paradigm of heroin and methamphetamine where we're like, well, everybody can't have anything until they get clean. Fentanyl requires medically assisted treatment because of the nature of the addiction, and we all have to be more comfortable with that and resource it to do it differently. And we're hearing that with the mobile work, but that is a conversation we're also having in the state as well. And every community is seeing that, and we need to do things differently. And frankly, it's something everyone across the country is also challenged by.
Brandon?
On coordination, you talk about those 8 a.m. calls, but from what I've seen, you've seen some new organizations, some organizations who can't make it. How do you ensure that all these private organizations, if possible, are on those calls and participating? Would you require that as part of government budget?
So I think that we've seen, the consistency of the 8 a.m. calls, I think, is the strength in them, right? Those are happening every day. We are aligning resources as people are able to join, right? They are joining and then being a part of the solution. I think this really speaks to, though, the work that is going to be happening under the homelessness response system and the homelessness response action plan in order to make sure that we are continuously having the conversations with all of the right partners, all of the right providers at all the levels of government that need to be there. We have to be building and focusing on this system that incorporates this response. As Mayor Wheeler says, there's such a higher likelihood that people experiencing homelessness are also going to experiencing fentanyl addiction, that we need to make sure that we have the right solutions that are targeted to that, and that we are doing that coordinated outreach. So for me personally, making sure, we were able to produce, as a part of a coordinated effort between the city and the county, a shelter strategy that really has given us goals and a pathway for building up our shelter system. We need to have that same thing, and I expect that we are having that same thing in terms of outreach and the way that we need to be coordinating and bringing together the outreach work that is happening in the city and the county.
Lucas?
Just a question for the governor. It's another report that has been coming out of Oregon State Hospital. Can you just address what you're doing to improve conditions at Oregon State Hospital? And specifically, can you also just answer why they're handing out condoms?
I don't know why they're handing out condoms. That was news to me. We're gonna ask them why that's happening. And we have been focused on improving the outcomes for individuals at the state hospital. As you know, it's mostly a population of folks who have been connected with the criminal justice system as aid and assist and getting ready for their own defense. My primary concern is making sure what we're doing there is evidence-based, we're supporting the workforce to do it, and we're gonna continue to monitor. But that particular little fun footnote was a surprise, and we'll be talking to them.
Emily?
I just have one more question for the county chair about the lights at the library. We had talked a couple weeks ago, and I spoke to the business owners in the area, said that, anytime lights went up near them, the problem was moved further down the street. And you said that that is, something that happens in the short term. I'm just wondering, is there anything in this 90-day report that directly answers the long-term question about the lights and about the impact they have on an area and what needs to be done in order to fully resolve the situation rather than just, move it down the street?
Yeah, I think there's a lot there, right? We know that in areas that are, hot spots or trouble spots, the infrastructure and the environment is really important to helping to deter activity there. We've seen that. That's one of the reasons why we did invest lights around the library, but it's also why we have been working with the city to put lights in other areas, including lighting under the bridges in the central east side area. That is something that the board just voted on a couple weeks ago. That is one part of the solution, but it is absolutely not the whole parts of the solution. The connection, the engagement of law enforcement and the work of the legislature to make sure that law enforcement can more effectively deal with the drug dealers that are frequenting those spots, right? That is a huge tool that and also needs to be brought to bear. The outreach workers for folks who are experiencing addiction, who are having contact, right? That is part of the solution. So ultimately, lights are a tool that we use, but it is just one piece of the overall work and the overall response that we need to have to these areas.
So I guess for people who are worried, now it's gonna come to my neighborhood, what would you say to those people?
Yeah, I think two things. One is that the work of this 90-day response was about learning how we better work together so that we could take and expand this kind of response citywide and countywide, and that's what you're going to see happen. I think the other piece of it is that people need to report these things so that we can get the response. So if you are noticing criminal activity, if you are concerned about safety, please reach out to law enforcement. Please be raising awareness so that you can get the response that you need. I think one thing that was a priority for all of us as we were going into this 90-day fentanyl emergency was recognizing that there might be a tendency for something to go from one place and move to another. We did see that happen during these 90 days, and we were able to then adjust the response to recognize that and to re-engage in that new hotspot, and that will continue post 90 days.
I have to excuse the governor, and then they can take, how about one more question each? Is that fair? Yes or no question, Brandon?
I'm not. When in other areas of the state, when can they expect coordination efforts or these outreach efforts that have happened here during the night?
That's a good question. So we needed to start in the central city. And what you're hearing here today is we've created a great foundation of how to approach it. I know Deschutes County, for example, had an emergency declaration as well. We are seeing challenges all across the state. We're gonna look at what's been done here, have some conversations, model it up. It's going to inform how I develop my budget for next year. No work like this is a foundation for more progress, and that means having conversations statewide, so I appreciate the question.
One more question total. Who has the last word? Hearing none. Ezra?
I'll just circle back to the whole MAT thing. I think one of the things that hasn't been discussed is, you all said that if we have been kind of treating this like we did with the heroin and other drugs in the past. With heroin, you can take somebody, give them MAT, give them buprenorphine, whatever it might be, Suboxone, and immediately get them into MAT. We also know that that's not the case with fentanyl. The strength of it, you can't actually just give somebody those drugs right off the bat. You have to withdraw them initially from the fentanyl. Given that, it makes it so that you have to have those detox facilities in place. I guess I'm still looking here, what's going to be done so that those MAT efforts that you're doing are actually able to be implemented, as you said, meeting people where they are.
Yeah, I mean, I hear what you're saying in that fentanyl is more complicated, it's more addictive, you need to have it more frequently, right? And it has a different impact physiologically on the body. We do have to be building out that system. We do have to be increasing the number of detox beds. We also have to be more effective and efficient, excuse me, in how those beds are being used. So like, absolutely, we have to be investing in those parts of the system as well. And when somebody is successfully detoxed, they need to have a place to go so that we're not just releasing them out into the street, so that they're not just having to come back to detox in another matter of days or weeks. And so that is also part of the work that we're doing, building the capacity, but also increasing the efficiency, so that people have a safer place to land, so that they're ready for treatment, they're ready for medically assisted treatment. And that is the work that we're doing. That is why the county is invested in multiple stabilization beds and with different partners, as well as making sure that we're using those detox beds wisely.
Do you have a target number of detox beds that you would like available in Multnomah County?
I don't right this second. But,
Adjourned.
yeah, thank you.